Alright, so this is the first of the pre-lab cyberanatomy videos that you'll be watching over the course of the semester. This will cover just the material that we're doing in the lab dissection for the day. The purpose of these cyberanatomy videos is to provide you with a cleaner look at some of the structures that you should expect to find in relationships you should expect to see. The dissection videos are really good at showing you what it'll really look like, but sometimes the visual resolution, it's hard to really see the difference between nerves and arteries and veins, and sometimes a more colorful, as you can see here, version of things makes it easier to learn the first time. So this is a supplement, part of the package of materials that you have to work with. So this is a program that you do have access to if you want to use this on your own to explore. It's on the Hardin Library website. There's a link on the links page from the Gristo lectures site. You feel free to explore and use it on your own, but these are put together for your benefit so that you don't have to go through the trouble of learning how to manipulate the 3D objects. It can be tricky for some, easy for others. If you're a video gamer, it's probably easier. But just briefly, I'll show you some of what the program can do, and then we'll get started. So I can grab and move any number of anatomical objects in any number of ways, so freely rotatable. I can zoom in really close if I want to see inside something, or zoom away if I feel like I've come too close. The detail level is generally at about the level of what you would need for medical school. We used the Netter Atlas as our design basis. Let's see, what else do I need to show you? Oh yeah, you can take it apart. So there's this peel function over here that you can use to pull objects off if you want to see what's behind something. The labels function is pretty helpful if you're learning the material. If you turn that on, that just stays on. And then if you mouse over an object, it'll tell you what it is. So that can be helpful. A lot of objects have multiple labels within them. Like say, I bet the clavicle has a bunch. If you click on this pins button and then click on the clavicle, you see there's a little number 13 there. There's going to be 13 little blue pins that are going to pop up. And if I zoom in, I think I'll turn it off real quick. And then zoom in. I can get in closer and mouse over the actual pins, and then that'll tell me what the different specific parts of the bone or whatever structure we're looking at are. So that's kind of cool. I'll just quickly turn those off so they don't get distracting later. That's probably all you'd need to know. The controls are pretty intuitive using a normal mouse, or you can use these different, you can break out the controls into different axes if you want. But if at any time it gets a little bit too crazy, just use this implode function and that'll pull everything back together, and then hit the home button and that'll take you back to sort of a neutral starting point. So that's probably enough for now. There's some other features we'll probably use later in the semester, but let's get started with today's work. So we're going to start with sort of this view of what you'll be seeing after you remove the skin from the cadaver. So we've got pectoralis major will be the big thing that you'll see. You'll see pec major on both sides. You might not see the sternum quite that bony. There will be a little bit of fat and connective tissue on it, but pectoralis major, clavicle, deltoid should be obvious, and we'll just be removing skin from kind of this area today. The next thing I want you to see is if we zoom up into this space between the deltoid and the pectoralis major. This is called the deltopectoral triangle. As you can see, it's kind of triangular shaped. There's a vein that runs right through that triangle called the left cephalic vein on the left side, the right on the right. And it's actually one of the superficial veins of the arm, one of the ones that you can access with phlebotomy. But it runs through this little space right here, so we're going to find it today. So we have a good example of a superficial vein. Our next step is to reflect the pectoralis major. We're not actually just going to cut it off like we just look like we did here. We're going to detach it from the clavicle, the sternum, and the ribs, and reflect it out while leaving it attached to the humerus. But you can't do that in the program, so I'm just trying to get you close. When we reflect pectoralis major, you will see pectoralis minor just deep to it. It's a lot different. It's a lot smaller. It has a different attachment. You can see that it attaches on the scapula on the coracoid process, whereas the pec major attached to the humerus. They're a little bit different muscles, and you should be able to see it attaching to the ribs. After we reflect the pec minor, that will give us access to some of the deeper structures in the axilla or armpit. We won't be going into that just yet. We'll do that when we do the upper limb. We're just going to try and find a couple of the big structures, and the biggest of the big would be this axillary vein and the axillary artery that's usually a little bit deep and superior to it. So find those. The vein will be very easy because it'll be dark. And then if you get in real close and sort of move the tissues around a little bit, you'll find there are these large clusters of nerves that are kind of wrapping around the axillary artery and vein. These are parts of the brachial plexus. There's the lateral cord that's lateral to it, and then there's a medial cord that's medial to it. And you should be able to find those clusters wrapping around the axillary artery and vein. So take a little bit of time in that space to find those. All right, our next objective is to identify the serratus anterior. This is an interesting muscle. It has lots of finger-like projections that attach to each of the ribs, maybe 1 through 7 or 1 through 8 or so. And it actually originates back on the scapula, so you can see the scapula back in there, and that's actually where that muscle started. But it comes up here, so it serves to pull the scapula forward. More on that when we get to the upper limb unit. But for now, what we want to do is we want to get the serratus anterior out of the way. So we're going to detach it from the ribs and then peel it outward. Sort of, again, that doesn't look particularly effective here, but I just sort of tried to get you there. By doing so, we've exposed the full extent of the anterior chest wall. You can see some of the intercostal muscles, the externals and the internals. But now we're going to cut open the anterior chest, and the video I think is going to do a way better job of showing you how to do that, because I don't have a saw in this program. But when it's done, it'll look something like this, and you'll be looking at 2 lungs and a heart. The first thing I'm going to have you do is try to get into this space between the lungs and the heart. So pushing the lung over, visualizing the root of the lung, and then trying to identify this nerve. The phrenic nerve, it's an important nerve that innervates the diaphragm. And this nerve runs anterior to the root of the lung. So you should be able to see it passing just in front on both the right and the left sides. So if you reach into that tight little space, push the lung out of the way, you should be able to identify the phrenic nerve. That's important because your next step is to actually cut through the pulmonary artery, the pulmonary veins, and the bronchus in the root of the lung. But I want you to make sure to do that lateral to the phrenic nerve so that you don't cut off the phrenic nerve. So when that's done, you're going to have lungs isolated out in the open. And you can do a little bit of right-left comparison, quick and dirty. Just by looking at the lung, you can easily see that the right lung has 3 lobes, the left will have 2, and then there will also be some differences in the surface impressions on the inner surface. These lungs are pressed tightly against the mediastinum, so they'll have these grooves and ridges where different structures have been. So for the most part, these are vascular, like the brachiocephalic vein and the superior vena cava create a groove on the right lung. There's a large one for the aorta on the left lung, the azygous vein as well. And then there's one for the heart on both sides, impressions. So that's sort of the scope of what we're going to try and do in lab today. That sort of pulls it all back together. Hope that's helpful, and we'll see you in lab.